It's the Lars with There She Goes on Dubai Eye 103.8. We've got a doctor in the house, and I can tell you we've got lots of correct guesses. Cedric, Ian, Clint, Mohammed, Amira, Leslie, Kapil, Pawan. You all know today's mystery flag. Another chance to hear that and win 1,000 dirhams to spend at Soul Beach after 3:30 today. We're talking health this hour, and news just this week from new research presented at the British Thoracic Society has revealed that patients who suffered from asthma ran a double risk of severe attack after COVID-19 restrictions were removed. It's so that as they were lifted, fewer people wearing face coverings, no social mixing, and subsequently a higher risk of acute respiratory infections. Now, asthma affects more than 30 million people globally. Chances are you have it or you know someone who has it. So what do you need to know about this condition? Joining us now, Dr. Syed Ashad Hussain is an experienced consultant respiratory physician. 3 decades of clinical experience working in the UK and the NHS. He's now at King's College Hospital. On hand to answer my questions and your questions. Doctor, how are you today?
Yeah, thank you very much. I'm okay.
Get ready for a busy hour because
Yes.
I think an awful lot of people have a lot of questions and uncertainties about asthma, and we really need some help when it comes to treatment, but also the future of treatment. What's happening in the world. Before we get into the text line and the nitty-gritty, can you explain in very simple terms what asthma is and what we know about what causes it?
Yeah. So asthma is a chronic condition of the airways. It is a condition which is variable. So what happens in this condition, the airway become tight and narrow. So when the airways become tight and narrow, people become symptomatic. So symptoms that are very important to understand are that people will have cough, people will have shortness of breath, people will have a wheeze. Wheeze is a whistling noise that comes from the chest. And they could have, again, chest tightness along with all these symptoms. There are some problems at the night time as well. So, making sure that we are, presenting these symptoms to a clinician, especially a pulmonologist, so if any of these are present, and could suggest that somebody is running an asthma as a diagnosis or has problems with asthma. Now, when it comes to etiology of asthma, why and what happens, it is a condition that is very prevalent in people who have allergies, who are atopic, and there is a genetic link to this. So about 40 to 50% of our patients would have a genetic link that somebody in their family would have the problem.
Interesting.
And
Would it be asthma in particular? Because in my family, I have asthma. My brother has asthma. My dad has asthma. It's all this kind of mix of conditions, I guess.
Yeah, you're right. So atopic dermatitis, skin problems, hay fever, all these things could be related. And these are the particular individuals who we call as atopic, and they are more prone to having these, asthma problem. There are about, more than 100 genes that have been discovered which could depict somebody having asthma. So there is a genetic link, but a lot of it is environmental as well. And
Well, that's what I wanted to ask you in terms of the time you spent in the UK. I mean, hay fever, always a fun one. But what about dust here in the UAE?
Yeah, absolutely. So it is a very important factor, the dust in the atmosphere. Because coming from UK, the problems I have noticed was more for the pollen. Because the pollen count goes high in certain seasons, and then you see a lot of asthma sufferers coming up with the symptoms into the clinic. But in UAE and in Middle East in particular, there's a lot of dust in the atmosphere. And there is estimates that about 5% more than what North American report of asthmas are we see in UAE. So we are seeing a bigger number. The recent estimate has been around 10 to 14%.
That's huge.
Which I think is a conservative assessment from what I've seen
that's what I was
coming
ask
from
you,
UK.
Because surely it takes some time to get a diagnosis because people don't necessarily know who to go to, and it can be misdiagnosed quite a lot as well. And also some people might just think, well, it's a fitness level problem. I'm just naturally short of breath. So what would happen in clinic in order to reach a diagnosis of asthma? What are you testing for and looking for, Dr. Syed?
It's a very difficult diagnosis sometimes to achieve or get, because on my start of my discussion, I said it is a variable disease. Now, variable disease means that on a good day, the patient is good. On a bad day, they are not good. So it could change from one day to the other. This is a very important fact in asthma problems. But when they come to us, we obviously go through a history, and in that history, I've just talked about that they'll get these symptoms. Nighttime symptoms are very important. The other thing they will tell us is that any smells, any fragrance, any change of atmospheric conditions or change in the temperature of the room, going from an air-conditioned room to a non-air-conditioned room, or having an environment which has deodorants or sprays or some sort of it could also lead that. And same with the work environment. If people are working in dusty, exposed in dusty environment, especially around the time that we have the dust storms, that this does aggravate the whole problem.
I wanted to ask you about that report we've heard about COVID-19 kind of doubling down on the symptoms that asthma sufferers have had. I'm sure you probably found the last couple of years really fascinating from an academic point of view as a pulmonologist.
Right.
What are we seeing in terms of long-term effects of COVID-19 on asthma figures and sufferers themselves?
Yeah, so as we know that asthmatics, when they get a viral infection, their control becomes bad. We have seen, I've been here working for 1 year now in King's College, and I've seen a lot of patients post-COVID developing cough, shortness of breath, sometimes wheeze, so asthma type symptoms. So there was an increase of patients after COVID that we've seen coming through to our clinics where they would have those symptoms. But it is important, as you touched on the topic of diagnosing. So I think it's important. One of the 3 tests which are very, very important. One of them is called exhale nitric oxide test. This is a breath analyzing test we could do in our clinic, in pulmonology clinic. And this gives us the level of inflammation and the allergy that is there at that particular moment. Mm-hmm. So we can do a spot check like a breath analyzing test as called FeNO. The other test that is very good is the CBC, where we check for eosinophil count. And the third thing is immunoglobulin E, very particular for asthma. So these 3 tests are like very much the biomarkers that are used around the world to diagnose asthma. Apart from that, we do spirometry, which is a blow test. We check lung volumes. And we can also do other tests like methacholine challenge testing in difficult cases. We sometimes need X-rays as well as CT scan. So there is quite a few investigative workout we can arrange. Now, if you're worried about somebody having pets in the house, like a cat, recent entry into the house, and then they will have high dog dander or cat epithelium, and that could be checked in the allergy test we do. Same as I've touched on dust. The house dust mite and also the dust allergy is a big factor. So these things could be checked from the clinic, and I think it's a difficult diagnosis to make, but it is very important to get the diagnosis right.
Absolutely. We're going to be talking treatment in just a few minutes. We're also going to be going to the text line. A message here from Serena saying, can you grow out of asthma? We're going to be talking about different treatments as well. And I think Leona's in need of advice. She's having some tough time breathing, and her trusty blue inhaler isn't doing very much. We're going to the text line 4001. You've got the ARN Play app. You've got the WhatsApp. You can be anonymous if you prefer. We're very much here to help. It is your free clinic here on Dubai Eye 103.8. It's all about your lungs between now and 4.
More of Afternoons with Helen Farmer is coming up next.